So, if you're a healthcare provider, you have definitely felt that massive shift toward virtual care. But with that shift comes a huge, and let's be honest, often really confusing question about all the paperwork and licensing. Okay, let's dive into this and get you some real clarity on telehealth credentialing.
All right, so this is the question, right? You're already credentialed to see patients in your office. Do you really need to go through a whole other process just to see them on a video call? I mean, it feels like it should be simple.
And look, the good news is, the short answer is no. You don't need a completely different type of credentialing just for telehealth. But, and you knew there's a but coming, didn't you? The real answer, the one that actually matters for your practice, is way more complicated. Because it all hinges on where your patients are and who's paying for that visit.
Okay, so let's dig into what this complicated no actually means. It's not about getting a new kind of credential. It's all about making sure your existing credentials and licenses are valid for the specific way you're practicing medicine online.
You know, a good way to think about it is this. Telehealth credentialing isn't some brand new process from scratch. It's more like an update or a background check just to confirm your current qualifications are approved for the unique circumstances of a virtual visit. It's an extension of what you already know, just with a few very important new rules.
And the single biggest rule, the absolute foundation that all of telehealth is built on, comes down to geography. Specifically, it's about crossing state lines, even when you're not physically leaving your chair.
And this right here, this is probably the most critical rule in all of telehealth. I'm serious. For licensing purposes, the law does not care where you are sitting. It could be your office, your home, a beach somewhere. It doesn't matter. The only thing that matters is the physical location of your patient at the time of that visit. That is the state where you have to be licensed to practice.
So let's just nail this down. If you're in California treating a patient who is physically in Arizona, you need an Arizona medical license. Full stop. Now, this used to be a massive headache, a huge roadblock, but now we have some really useful workarounds. For physicians, there's the IMLC, and for psychologists, there's PsyPact. Both of them create a much faster, more streamlined path to getting licensed in multiple states.
And don't underestimate how huge these compacts are. We're talking about the IMLC now, including over 40 states and territories. That is a total game changer for providers who want to expand their virtual practice. So if you're even thinking about practicing across state lines, this is something you absolutely have to look into.
Okay, so you've got your state licenses started out. Great, but you're not done yet. Not by a long shot. There are 3 key players you still need to get the green light from: the hospitals you work with, the insurance companies you bill, and of course, government payers. Let's tackle each one.
First up, hospitals. Now, the good news here is a really useful concept called credentialing by proxy. And this is pretty cool, actually. It basically means that if you're fully credentialed at your main hospital, another hospital can choose to just accept that credentialing to let you provide telehealth services to their patients. It's a huge time saver, especially for specialists who consult in rural areas. But, and this is super important, you can't just assume this will happen automatically. Some hospital systems will still make you fill out a full, separate application, even for virtual-only privileges. So the bottom line is simple. You've got to pick up the phone, call the medical staff office at that other hospital, and ask them directly about their specific telehealth and proxy credentialing policies.
All right, next up, private insurance companies. Now, for the most part, they see telehealth pretty simply. It's just another way to deliver care. If you're already in network with them to provide care in person, you're usually covered to provide those exact same services virtually without a whole new credentialing ordeal.
But of course, the devil is always in the details, right? And in this case, the details are buried in your contract. Your agreement might have geographic limits, maybe only covering patients in certain states, and you can bet they will absolutely verify you're licensed in the patient's state. Oh, and critically, the payment rate for a virtual visit might be different from an in-person one. You have to confirm all of this stuff before you start billing.
And finally, let's talk government payers. And you really have to pay attention here because Medicare and Medicaid are 2 totally different animals. Medicare, that's a federal program. So once you're enrolled as a Medicare provider, you are generally covered for telehealth across the country. But Medicaid, that's run by each individual state. And that means you have to enroll as a provider in every single state's Medicaid program where you plan on seeing patients.
Phew. Okay, I know that was a ton of information and a lot of watch out for this and don't forget that. So let's turn all that potential confusion into some real clarity. Let's build an action plan.
And believe me, we need a plan. Because this quote right here, it's so true. When you're trying to jungle applications for different states, different hospitals, and different insurance companies, the paperwork can just become, well, completely overwhelming. It's easy to get buried.
And this is why you have to get ahead of it. Just look at these numbers. The average credentialing process can take anywhere from 90 to 180 days. That's 3 to 6 months of just waiting. If you're not proactive about this, you could be sitting around, unable to see patients or get paid.
So here it is, your 6-step action plan to get this under control. Number 1, check your licenses. Just map out where you can currently practice. Number 2, investigate the compacts. See if the IMLC or SIPAC can make your life easier. Number 3, review your insurance contracts. Go find those tricky geographic limits and payment rules we talked about. 4, clarify hospital privileges. Pick up the phone and ask them about their credentialing by proxy policies. 5, organize your records. Seriously, get all your licenses, certifications, and training docs in one easy-to-find place. It'll save you so many headaches. And finally, number 6, stay informed, because the rules for telehealth are always changing, especially now.
You know, what all of this really comes down to is a shift in mindset. To really succeed with telehealth, you have to become a proactive provider. You've got to own the business side of your virtual practice.
So let's boil it all down. What's the bottom line? First, no, you don't need a totally separate type of credential. But, and this is the big one, you must make sure your current ones cover your virtual practice. Second, you have to be proactive. Get all these approvals in place before you see patients. And third, remember the consequences for getting this wrong are serious. We're talking everything from denied payments to, in the worst case, action against your license.
Look, virtual care is here to stay. It's not a temporary thing. The future of healthcare is hybrid, a blend of in-person and telehealth visits. And getting a handle on these administrative details isn't just about paperwork. It's about protecting yourself, your practice, and most importantly, your patients.
Because taking the time to master this stuff now isn't just about ticking boxes. It's about building a practice that's agile, strong, and truly ready for the future of healthcare. So I'll leave you with this to think about. Is your practice really ready for what's next?